Hi, welcome back to Mel's Health. I'm Mel, and as always it's lovely to have you here with me today. If you've seen some of my previous videos, you may have heard me mention on a few occasions that 2020 was an absolutely ridiculous year for me in regards to health issues. It all started with a migraine that started on Christmas Day 2019 and just decided that it wanted to stick around, and it ultimately led me to being diagnosed with Bell's palsy and having to deal with half my face being paralysed for some time. I've decided to split this information into two videos. This video is primarily going to talk about what Bell's palsy is and the main things that you want to know about it. And then the second video is going to be a more in-depth look at what it's like actually dealing with it. Horrible photos and all, because I kept track of what I looked like throughout the whole time that I had it. So hopefully by the end of both, it will be quite helpful for someone out there who's newly diagnosed or would like some extra information about it. So what is Bell's palsy? It is a condition that causes temporary weakness or paralysis of the muscles in the face. It can occur when the nerve that controls your facial muscles becomes inflamed, swollen, or compressed. The condition will cause one side of your face to droop or become stiff. You might also have difficulty closing one eye and smiling properly. It is a temporary condition though, and for most people you'll see improvement within the first couple of weeks, and usually all symptoms will go away after a few months. It also gets its name from anatomist Charles Bell, who was the first to describe this condition. So what causes Bell's palsy? So Bell's palsy occurs when the seventh cranial nerve, also known as the facial nerve, becomes swollen, inflamed, or compressed. This nerve passes through a narrow, bony area in the skull. When this nerve swells, even just a little bit, it's going to push against that hard surface of the skull, so it's going to affect how well that the nerve works. The exact cause of Bell's palsy is actually unknown, but many medical researchers believe that it's most likely triggered by a viral infection, and is stated to not be contagious. Many health websites have the same list of potential causes on their websites, as you can see here from the Mayo Clinic and Healthline. So things like cold sores, the herpes virus, chickenpox, shingles, measles, mumps, the flu, and other respiratory illnesses appear on both of these lists, so there's a lot of potential causes for Bell's palsy. What are the symptoms? I think when most people first hear about facial drooping, the one thing that comes to mind is stroke. But most of the time, when someone's having a stroke, the nerve that affects the facial muscles is also affecting other parts of your body too. So it's stated on a lot of health websites that if it's just your face that is feeling numb, stiff, and drooping, then it's quite likely Bell's palsy. But it goes without saying that if you're experiencing anything like this at all, that you get yourself straight to the hospital as soon as possible to get checked out. Once again, here are the things listed on the main health websites about what the symptoms are of Bell's palsy. Things like drooling, having a headache, inability to make facial expressions like smiling, having difficulty eating or drinking, the lack of taste, particularly on the affected side, having dry eyes on the affected side, having an increased sensitivity to sound, and having facial muscle twinges. I can definitely relate to a bunch of those symptoms, which I'm gonna speak more about in the next video. But I absolutely could not smile properly. I couldn't raise my left eyebrow. I had to drink everything through a straw, and I couldn't really taste much the entire time that I was going through this. I couldn't close my left eye, and as I said earlier, I had that constant headache that just sat on the bottom left side of my head here, to the point where I was even in hospital and they gave me IV pain medication for the migraine, and it didn't even touch it. It just sent me to sleep for about 30 minutes, and then I woke up with the exact same headache. So how is Bell's palsy diagnosed? Most of the time, the doctor will just do a physical examination. They'll get you to make certain facial expressions, and they'll just ask you questions about how you're feeling. That is generally enough for them to diagnose this and start treatment. In some cases, CTs or MRI scans might be ordered so that they can see if there's any possible underlying conditions contributing to the irritation of the facial nerve. They may also do some blood tests to rule out other things such as diabetes, as that can be a contributing factor, or to see if you've got any bacterial or viral infections. So how is it treated? The information that you get online is a very similar outlook to how I was treated, but how long you receive the medications for will be down to how your GP wants to treat you. I was prescribed a muscle relaxant, which was cyclobenzaprine, an antiviral, valacyclovir, and a steroid, prednisone. Alongside this, I was also given Tobrex eye ointment. I have personally known 2 other people that have dealt with Bell's palsy, and we were all treated completely different. Whereas the types of medication we were given were the same, it was the length of time that we were on it that varied depending on who our doctors were. I was on medication for 7 days, and at one point I was taking up to 17 pills during a day, whereas someone else I know was only given meds enough for 3 days. Once you finish that course of medication prescribed to you, it's not something that you keep going back for more with. Once that has run out, you are just left to continue fighting these symptoms using painkillers and the eye ointment as needed. So once my week was up, obviously I didn't really have much change in my face at that point, and my eyes still wouldn't close. So I was taping my eyes closed every night with the ointment in it to stop it drying out. And I was just taking anti-inflammatories or painkillers where I needed to. So what's the recovery time? There is no definite answer to that one, I'm afraid. It is different for absolutely everybody. Upon diagnosis though, they will likely tell you that you may see improvement within the first 2 weeks, and that the bulk of people are fully recovered within 6 months. In my opinion, I think there are so many personal factors that contribute to the recovery times, and I'm going to go over those in my next video. One last piece of information I wanted to give before I wrap this video up is the difference between Bell's palsy and facial paralysis. I didn't know this when I was going through it, but after some research, I found the Facial Paralysis Institute online. And they say that the main difference is having a cause. When a patient is diagnosed with facial paralysis, a cause can be identified, whether it be a tumour, an infection, or nerve damage. In cases of Bell's palsy, the disorder is appearing without any notable cause. Facial paralysis in most cases appears to be more permanent or lasts for years rather than weeks to months. And it's stated on there that if a patient with Bell's palsy is still having full effects after the 6-month point, they should seek treatment from a facial paralysis expert. So there we go, Bell's palsy explained. I do hope this was informative and helpful for anyone out there who was looking for more information around the condition. There are links in the description below if you want some more information around this topic. The next video will be a more in-depth look at what it's actually like going through this and what led me to being diagnosed with it. Terrible looking photos and all. Please give this video a like if you learned something today, and hit the subscribe button so you can follow me for more weekly content. All the support I get is very, very much appreciated, and as always, I thank you very, very much for watching, and I'll see you soon. Bye.